pleasure for me to be here today to speak on behalf of the Colorado Association of School Nurses. My name is Tammy Wollbrinck. I'm a registered nurse in one of the large metro school districts, and I've been working as a high school nurse since the late 1990s. My background is that of an EMT, a certified emergency room nurse, and an EMS instructor. With that history, I usually feel extremely comfortable with any situations that present in my health clinic. However, the unknowns that have been presented with the newer forms and potency of marijuana really do scare me. When I went first into school nursing, the student that was brought to me because of smoking marijuana usually presented with a really strong odor. They had glassy eyes, they had red conjunctiva, and they were usually pretty laid back. Now I have no idea what to expect. A complete assessment is required of each student, and then the decision as to whether we are at the peak of the effects that are being caused, or if the worst is yet to come. Students have come to me crying because they feel like they're having a heart attack. That's usually caused to the fact that they're having chest pain from severe rapid heart rate. I've gone to the student because the teacher cannot rouse him or her to come to the clinic. As a matter of fact, they can't even get them to leave the room after the bell rang. I've been called to the dean's office because the student is in constant motion, argumentative, and yelling for no known reason. I have had crying parents bring their students to me because they're extremely worried about what they're seeing and they don't have a primary care provider, so they start with me. My assessments of these students have revealed heart rates that are sometimes in the 40s to above 200. Now you need to remember that a normal heart rate is usually 60 to 100. Because rapid heart rates are difficult to check at the pulse points, I usually listen avidly. While I'm listening, it's not unusual for me to hear a heartbeat that has what we call an S3 sound. To me, an S3 sound for these kids sounds like their hearts are beating up against the chest wall. There's that much pressure. Occasionally, the heart rate is so irregular that it's difficult to count. I've seen blood pressure readings ranging from 80/60 to 220 over 108. Temperatures may be normal, and frequently they're up above 100. Pupils are often dilated. Students may have horizontal and or vertical nystagmus. What nystagmus is a vision condition in which the eyes make repetitive, uncontrolled movements, and the student is unable to focus on objects. They also were unable to pass the near-point convergence test, which is a test used to assess if an individual's eyes are able to work together as objects come close to them, or if they begin to have blurry or double vision. Occasionally, the eyes are glassy, and the conjunctiva, which is the mucous membrane that covers the front of the eye and lines the inside of the eyelid, are red. Frequently, the student has hand and possible head tremors, and unsteady gait and slurred loud speech are seen frequently. Initially, I was extremely confused about all the different signs and symptoms I was seeing. What I have learned is that symptoms presentation is dependent on the grade of the marijuana that's been used, the level of the THC that's present, the substances that the marijuana have been mixed with, and the tolerance that that particular student has. The early days of marijuana with THC levels of 2 to 7% are long gone. I've learned to treat these symptoms, make my decisions on my assessment, and that this is one area that I can truly have no expectations. Many of the symptoms that I see are extremely reminiscent to the care that I gave the patients that were suffering from cocaine-induced heart attacks during my emergency department days. I want to make just one final note. Sadly, we've all seen a huge uptick in mental health issues among adolescents in the past several years. I have personally lost several students to suicide. These students have been in therapy and frequently taking antidepressants. During conversations and discussions with them, it's not uncommon at all for them to talk about using marijuana because it makes them feel better. I find it extremely upsetting that my students are combining marijuana with other drugs. I'm also very concerned that they may increase their marijuana use to keep feeling better. Or they may get hold of a marijuana that has an extremely high THC level or that has been mixed with other substances which interfere with their thought process. Any of those combinations may have contributed to the completion of the Suicide Act from the students that I have worked with. Thank you.